Good morning, and welcome to another segment of Issues That Matter. One of the goals of this program, just to remind you, is the world is getting ever more complex, especially in the healthcare arena. And I don't see it changing anytime too soon. And what we want to do here on Issues That Matter is try and help people wade through the complexities in a format that they are comfortable with, in a forum that is effective. And thanks to the good auspices of the Biddeford Public Access, this is the forum. Today, we're going to be dealing with mental illness. And I have two people here representing NAMI.
Well, we're not really representing NAMI. We're representing ourselves.
Okay. Well, then, on that note, why don't you introduce yourselves?
Okay. I'm Joanne Livingston. I'm the volunteer and development supervisor at Goodall Hospital. That's what I do for a living. I'm very passionate about my community, very involved in all sorts of organizations. I do lots of volunteering and fundraising for a lot of organizations in my community. I feel that I've been I'm an informed citizen, but sometimes things come up like mental illness that make me realize I'm not really as informed as I thought I was.
And if I can ask, what brought you to mental illness?
Well, last year, a very close family member went through a mental illness crisis. Before that, I didn't know anything about it really, other than that it was there. And when somebody that you love suffers a significant medical issue, it's my personality to kind of dig in and learn as much as I can about it. And in that process, I learned that there's over 60 million Americans that are affected by mental illness every year. That number just blew me away. In their lifetimes, 1 of 4 people will be affected by it. So, that just totally baffled me. The person that kind of brought me to it was a young adult. I didn't see mental illness as a young adult issue, but I learned that is an age where so many people are first. I guess that mental illness first appears in a lot of young adults. I think that we had a very comfortable household and everything was great. And all of a sudden, people go off, they grow up, graduate from high school, and then they go off and start their own lives and everything. And it's a really big transition. And I think that the stresses of all of that, trigger some issues. And so for me, it was like falling off the end of a cliff, that, going along and feeling like, you've done a good thing and, life is good and you have all of your ducks in a row, and pretty much in the blink of an eye, you find yourself in situations that you never even thought you would be in. And when that happened, when the mental illness crisis appeared, I was so unprepared for it. I didn't even know what resources were available. I didn't know anything about it. I didn't know what to do. I was just, and I'm the personality that I like to have information and I like to make a plan. So all of a sudden my plan was totally derailed. And I guess that really what I learned is that mental illness affects anybody at any time, anywhere. It doesn't discriminate. It has, nothing to do with backgrounds or histories or female, male, whatever. It affects anybody at any time. And you just don't know who's going to be the next family that it appears. And I guess that really why I'm here is because I hope that through, this segment of Issues That Matter, that we can help some other family when, if they encounter an issue, that at least it won't be so much of a new concept or a new idea, that they'll have at least heard something about it and know, okay, I'm not alone. There is help available out there.
Well, one of the things that I just picked up, and this is a major thing that I just picked up in what you just said, it wasn't necessarily the content of what you said, but the passion that you have behind what you say.
Absolutely.
And I'm sure that makes a big difference, not only to your daily life, not only to your commitment, but to how you deal with people that are facing the issues. Cherie.
My name is Cherie Monson. I'm the nurse manager of the emergency department at Goodall Hospital. I'm also very involved in the community. I participate on multiple committees through the schools. I have done presentations at schools in our area that come to Sanford Hospital. I also am part of a police task force and the drug-free community task force. I became involved in this. I'm very passionate about the mental illness issues that are in our community. I became involved in this because I myself am also affected, like Joanne, because I have a family member who had depression, and he self-medicated, and he became a drug addict, and he was addicted to alcohol as well. We had gone through everything multiple years ago, and he started when he was in his 20s. My parents thought they were safe. We'd gotten through all the teenage years, all the troubled years when you think that you have all these problems. He was actually married and having his first child when he started abusing drugs and alcohol. And he was addicted for quite a while, and I don't think you ever become unaddicted, but he did go through multiple programs, and he stopped doing drugs and alcohol for about 7 years. And then last year he had a crisis in his life, and he went back into a depression. And 3 months from that crisis, unfortunately, my mother and I found my brother had died from a drug overdose. It was an accidental one. My children were involved. We were all visiting. They do not live in the state. We were visiting at the time. It was a huge trauma. Family had to come from all across the country for a funeral. My mother had hidden that he had these issues for a very long time. She was very embarrassed, and that was something we actually disagreed on, because I feel that there's a real stigma to mental illness, drug and alcohol addiction, and people don't want anyone to know that you have it. So what I discovered was that my mom was one of them, and I tried to educate her, and in the end it didn't matter, because everyone then knew that her son had these issues. It was wide open when, he passed away. So my mom was insistent then that there would be more awareness and education. So she told people she didn't want flowers at the funeral, and she asked people to make donations. The particular organization, the mental health organization they made donations to, called my mother a few weeks after the funeral and told her that they'd received more donations on that particular funeral than they ever had on anything else that they did not fundraise themselves. They had ran out of donation cards. They had to get more made. Money was continuing to pour in. And that was a real eye-opener for us, to think that people really don't tell you to donate to mental illness, even though people die every single day from that. If you had diabetes, or if you had a cardiac disease, a heart attack, families are very willing to put on the obituary, please make a donation to the American Heart Association or the American Diabetes Association, but nobody wants to write the mental illness or NAMI.
Yeah.
So we would like to bring awareness to that. We're very passionate about people knowing more. Education is power.
Now, I know that there's something coming up in the very, very near future relative to fundraising and awareness, and that's one of the reasons why you're on the show.
That's
is
right.
To try and raise awareness.
September 29th, their NAMI Walk. NAMI stands for National Alliance on Mental Illness. They were founded in 1979. They're as a grassroots national organization, and they are really the only and the largest organization that their sole focus is on mental illness. They provide advocacy, education, support for families that are focusing on, that are dealing with mental illness. So this year they're having their walk on September 29th. It starts at 11 a.m. I'll be in bed by then. So it starts at 11 a.m. at the Southern Maine Community College in Portland, and they're raising money and awareness for mental illness. Cherie and I have formed a team. It's called Team Hopper in honor of her brother. And so I'm going to be walking. Cherie's going to be cycling because there's also that cycling component of it. It's 5K for a walk and 25 miles for the bike. And we're just trying to raise awareness and to raise a little bit of money for NAMI, which is, like I said, the organization that focuses on mental illness.
How many people participated in the walk last year?
I don't know. Yeah, I don't know.
Sure.
Yeah.
We have so far 6 people signed up on our team on the website, and I think we have a couple of more that are signing up. And the 25-mile bike ride actually starts at 10 a.m. and it's at the Southern Maine Community College. Mm-hmm. So this Sunday.
Yeah,
you going to come with us?
In my heyday, I might have entertained it, but today, unfortunately, the multiple sclerosis kind of gets in the way.
So there are ways that we're really, trying to advocate and raise awareness for mental illness. Whether people can come out and walk or ride or not, they can support us. They can go. NAMI Maine is a wonderful organization, and they have a great website that you can go on and get all sorts of resources and information. Even if maybe you're wondering about somebody that that you kind of suspect, do they have an issue or not? You can go onto their website, gain information. They have a lot of information, and you can also go on their website, and if you want to support us, go to NAMI Walks, and you'll find our name, Team Hopper, and then they can do a contribution under our names. If they want to register and walk, they can also register at that same time.
Okay. Now, relative to support services that might be available to people that have a mental illness, are there support groups that they can?
There's multiple groups. There's some support groups. There's also counselors in the area. What I would recommend that if you feel you need help or your family member needs help and you don't know where to turn, you can either call your local hospitals or you can call crisis response services, and most people would know that as CSI. There's a 1-800 number. It's staffed 24 hours a day. That is, I'm also a healthcare worker. I am a nurse in the emergency department. And so we use crisis response services for patients that are in crisis or even just ask for help or they need direction. There's other places that are in the area as well. There's Day Owl, there's Sweetser, there's one other place I've lost the name of. But if you call your local hospital or CSI, they can direct you.
And I bet if you called your local police station too, that they would be able to get you in touch with resources. Another idea that just occurred to me is that 211, which is a program that is funded through the United Way and the Partnership Alliance of Maine or something. It's a toll-free number that anybody in Maine can call at any time, and they will tell you what resources are available in your community for any issue that you have, and mental illness being one of those issues. If you called 211, they'd be able to direct you also.
For clarification purposes, before I said the MS gets in the way, and in point of fact, I'm going to be volunteering at the MS Walk in York next Sunday.
Oh, good.
So it does get in the way. Over and above the fact that the days of me being able to walk 5 miles are...
Well, we would have helped you.
Well,
I can be a drill sergeant when I need to.
One of the things, Bob, that Cherie didn't really talk a lot about that she's doing in our community, I mentioned that the person that suffered mental illness in my life was a young adult. And what that made me realize is that in high schools, in our school system, they don't really talk, our staff really doesn't know, they don't know a lot about what to look for, what kind of signs might there be. So Cherie and some of the other healthcare people in our community are going out into our schools and trying to educate our teachers, our guidance counselors, our staff, our nurses, all of those people, what should they be looking for, what kinds of things, and to make people aware that this is out there. It's out there. It's not going to be held back. We think that our kids and people are all protected, and they're not. It's very relevant, and Cherie is a very big advocate in our community trying to educate people, because education is the key. Talking about it, making sure that people know that it's there. We need to address it. It's not going to go away.
What education resources are out there today for people to increase, over and above what we're doing here today as an example, to increase their awareness and their knowledge of?
Not enough, for sure.
But for instance, I have done a suicide awareness prevention clinic. Yes, with one of the schools. That was in conjunction with NAMI. They had a big part of the day. I also went over and represented from the healthcare side of it. Then there's also pamphlets that we pass out. There's different information that is available at the schools. Unfortunately, they find that the schools, when the parents come for the parent-teacher nights, they don't really go and get any information. They're afraid almost of the table. So they'll tell them, please come and see me, and it'll be about drug, alcohol use, because children are using it. I know people like to think they are not. They are using drugs and alcohol. The drugs are coming from your cabinet. The alcohol is coming from your cabinet. So they are using it, and we're trying to get more awareness of that, get parents more involved, and they don't take any of the information. So what I'm currently doing is I'm having it passed out to all parents of children between the age of 14 and 18 in the high school age that come to the emergency department. We'll get a pamphlet, and it's a whole packet actually with different pamphlets, and it'll have like the crisis response number in it. It will have if your child is doing drugs, if your child is drinking alcohol, if you feel you have a problem. There'll be all kinds of education in this. As well, they could call this 211 number, and they will give you directions. NAMI has different workshops on their website that you can go to and see where you can go and get education.
Are there any, what I refer to as road signs out there that might alert people if they observe something? Yes, this is an issue having to do with mental health.
Well, I would like to start by addressing that as somebody with a younger person. They're looking back at, it's like with all illnesses. My husband had a major medical issue, and looking back, it's like, oh my God, there were signs. We just didn't see them. It's the same way when my young adult, encountered issues. Looking back, it's like there were signs. But what are the signs? Are they normal changes in behavior patterns, effect that are associated with, growing up? It's hard to really find the signs and stuff, but I think really the big issue is to just be open to looking at it. You may not always know, but you should at least, if you suspect at all that somebody that may have an issue with a mental illness, try right off the bat to try to get them into counseling or get them to be evaluated, and then go from there.
And things that I recommend that people look for is change in behavior, which, as Joanne said, could be just they're growing up and getting older, but look for, how are they dressed? Are they disheveled? Did they used to be clean cut and, very nicely dressed? Is suddenly there a change? Is there a sudden weight gain, a sudden weight loss? A change in just their habits, their cleaning habits, their brushing their teeth habits, anything along those lines, any significant changes. Suddenly they're more agitated than they were before, more anxious. They're worried about things that they probably wouldn't have been worried about before. People who, if your family member suddenly starts hallucinating or sees things that aren't there, that's a crisis. They need to be evaluated by a professional to see what can be done.
What would be the first step for a family if, let's say, it's a family member observes a change in behavior, erratic behavior? What would be the first step for them to seek out assistance?
Depending on the severity of it, for instance, if somebody's behaviors have just changed, they're probably not taking care of themselves as much, they're more withdrawn, they've had some weight loss, I would recommend you call your primary care physician. That should be your first phone call. Let him or her know what's going on. Get in for an appointment as soon as possible. I'm finding that physicians are becoming primary care physicians are more alert to these. They're screening their patients more for these behaviors, and so they want to get you in quicker rather than later. if it's more severe, for instance, they're hallucinating, they think people are talking to them, they see things that you don't see that are there, then that they should either come to the emergency department or they should call this crisis response services that is manned 24/7. Like I said, there's a 1-800 number you can get, and call them and talk to somebody there, and they'll direct you whether you need an emergency department. You can come into their office. They will do an evaluation over the phone. You can walk into their building anytime. They have one in Biddeford. They also have one in Springvale. So during that is manned 8 to 4.
Okay. Now we've been the country's been involved in a lengthy fracas, you might say, war in the Middle East, and I know PTSD is a big factor in dealing with veterans. Have you seen a good number of people, or are you aware of the numbers of people that are suffering from PTSD here in the state?
We are seeing a lot of patients that have PTSD. I'm not sure, although there's a lot that are coming back from the war, you're correct, that is what we are seeing, some of those patients. But there's also people who maybe they're being diagnosed with it more because there's more of an awareness. They've had a trauma in their life. It's not necessarily they went to war, but there was a trauma that they sustained somewhere in the last few years. They may need help for a couple of years. They may need help for the rest of their lives. The patients who we're seeing from the war, they're coming in, they're severely, hurt. They've got other issues, medical issues that go along with this on top of the PTSD, probably depression. They're having a hard time integrating back into regular society. It's a hard life for them.
Another issue, Bob, that I've realized with mental illness, it's treated very differently than any other major medical issue. If somebody has cancer and they have their bald head, everybody kind of rallies around them and show support. What can we do? And they're perfectly comfortable going up to somebody who's ill from another major illness and sharing their sadness or concern for them. But when somebody is affected by mental illness, it's people are very standoffish. It's hard. They don't know what to do. They don't know how to respond to either the patient or their families. It's really strange. Cherie and I have talked about this many times about even in insurances, how the insurances cover for a mental illness. It's not reimbursed at the same rate as people are have other major illnesses. If people come into our emergency room and they have a mental illness and they need to go to a different facility that specializes in that, there's a very limited number of beds available, and we can't let them go until they have a place to go to. So they may end up spending days in our emergency room where we're just kind of watching them, waiting for a bed to open up. Would that happen to somebody that was having a heart attack? That would never happen.
There's protocols for patients who have heart attacks. Unfortunately, patients who have mental illness, although there's protocols, there's no beds. We need more beds. And this is not something that is just a Maine issue or, a Biddeford issue, Sanford issue. This is something that's all across the country. It's all across Canada. Other countries are dealing with it. We have more and more people that are in crisis, and they don't know where to go. They don't know what to do. And they're spending more and more time in the emergency departments. They're not getting where they need to be and getting the care that would be the golden standard. And as you said, if they had had a heart attack, the golden standard would be to go to a tertiary care center and get your heart attack dealt with. You would get a stent or somehow treated.
Yes. I mean, a person would have to be a fool to argue with that. Where I suspect concern enters into it is cost. We have increasing demands put on our
Healthcare
healthcare system, and every demand requires additional monies. And I know we have some major shifts in healthcare going on, and that's one of the reasons for the show, because it's become much more complex, and there are things to be concerned about today that yesterday we didn't have that concern.
Well, Bob, my argument for spending more money focused on mental illness is that there are nearly 60 million Americans that will encounter a mental health issue every year. That's one thing. Secondly, look around at all of the major mass casualty incidents that have occurred in the last few years, and that have a component that is associated with mental illness of why they happen. I mean,
look at what happened just recently.
yes, yes.
Washington,
So how
D.C.
can we not, as a society, spend money on this, which is a major issue? It is a major issue, and it's going to be.
And I can't give you the data, but there is data out there that supports if these patients who have major mental illnesses had somebody monitoring them or a caseworker that followed them on a regular basis, checked up on them to see how they were doing, because they have other health issues going along with this. So they made sure their diabetes was in control and they were taking their meds for their cardiac issues or their high blood pressure, whatever was going on, plus their medications for their mental illness. There's less admissions to the hospital. There's less crises, so they end up in the emergency department less and a crisis unit less. That saves healthcare dollars there, but unfortunately it gets to the point where it is more costly because they're ending up in emergency departments, they're ending up in inpatient units, and there's a way to head this off. Unfortunately, it's the money needs to come up front.
And it's not just the money, though. Look at the wear and tear and the toll on the families, the innocent victims, of casualties, or the fallout of people, not being treated. One of the things that I learned when I was, learning about mental illness is that it often starts as a young adult, but people are rarely diagnosed right at that stage. People some people go almost their whole life without proper diagnosis and treatment for their mental illness. And that's the concern. We need to catch it earlier. We need to be aware of it. One of the things Cherie and I have mentioned, and this just goes on to show about, as society, how we view this so differently. Two very public women in our society, Angelina Jolie, she went and she had surgery for a proactive surgery for breast cancer. Everybody was like, wow, what a hero. What an amazing woman. Catherine Zeta-Jones, on the other hand, came out, and when her husband was diagnosed with cancer, she came out and said, after years of having her bipolar treated and managed, the stress from dealing with him having a major illness has brought the flare-up of her issues with bipolar. Who's jumping up and down and saying, wow, what a brave woman for bringing this out? I haven't heard much about it. Have you?
No, I
haven't.
haven't.
I'm listening, Bob.
No,
I'm listening for it.
No, I haven't.
And isn't that shameful?
That's I would say that's very real.
Yeah.
Very real.
Mm-hmm. And we should be applauding her, because as a very public female role model and figure, what good she could do for our society if the media went to her and said, let's take this and go with it. Mm-hmm. She could be a great role model, and she could bring a lot of awareness to this issue. But yes, nobody's really grabbing onto that.
I absolutely agree. We've got to get rid of the stigma. Mm-hmm. You've got to have a positive impact on eliminating the stigma, because the stigma prevents people from taking the steps necessary for treatment, as well as diagnosis.
Mm-hmm. Yep. Yes.
Now, I did do some research, a little bit of research, and I did find out some details that I did not want to ask you questions that you might not be able to answer. Mm-hmm. So I'm going to take it upon myself to just speak of some of the things, such as, in the state of Maine, nearly 35,000 of Maine's 1,200,000 residents have a severe mental illness. And that's based on the U.S. 2000 census. In the year 2000, the estimated number of people age 18 or older with a serious mental disorder living in Maine, and this is excluding the homeless people or people in institutions, was 26,000. a lot of people.
I bet that's really low. Those are 2000 census. That's 2000 census data, and I think that Cherie will agree that in the last 13 years that the incidences have gone
Just
way
increased.
up, way up.
Increased. The past year, we've seen a really large jump.
What do you think, just based on your observations, based on your inherent knowledge, what do you see as the factors that have caused this significant increase?
I think that the economy is affecting people. Less people are able to find jobs, healthcare, they're losing healthcare, which is a very big stress to people. Depression is a lot of what we have been seeing. I think the people, like you said, you mentioned the veterans, they're coming back now from the war. They're traumatized from what they've seen and what they've been through.
And their families,
Yes.
maybe seeing a parent go off to war and come back, scarred, leaves a scar on children, and the post-traumatic stress is not limited to the person going off. It can affect the whole family. And I think, like Cherie has said, that we live in a society where there is so much demand for everybody, for everything, to always be at your best. And I think that drive to always be perfect and to do good really causes a lot of people a lot of anxiety, because there's that sense that you never quite measure up. And I think that leads to a lot of other issues. And the economy, absolutely agree with that. In my position as a volunteer coordinator, I have a lot of high school students that come in and they want to volunteer or job shadow or something, and I'm seeing a really marked difference in their behavior in the last 3 years, because I hardly ever see any of them come in anymore that hasn't had a parent, a family member, a loved one unemployed, or seeing that their social stability has really been, their economic stability has really been affected. They're much more grounded now than they were 3 years ago. They know that nobody's going to just give it to them, that they have to be willing to get out there and work and earn it. So I think that a lot of the issues, the reasons why we're seeing such an uptick in mental illnesses is really an effect of all of the stuff that's really gone on. The banking crash and unemployment and the demands. Our children grew up in a time when there was just excess. There was so much demand on them. They were, really doing a lot of things, and it really was a crazy time.
And to go along with the insurances, people are now making choices. They're taking insurances with higher deductibles. They can't afford. They have to pick. Do I feed my kids this week, or do I pay for insurance this week? They take higher deductibles. Well, that brings them to their doctors less, or brings them to preventative care less. Preventative care is really what they should be doing. It would be cheaper, but unfortunately people are afraid to go because of how much it's going to cost, and that is an issue for people.
You mentioned preventative care. What type of preventative care is out there for?
Well, I guess that maybe was, I'm encompassing just care in general.
But,
I guess you're right.
But it's a good point, though, Cherie, which you mentioned earlier. Your first place that you would go is your preventive care, your PCP. They are the first line of defense, and they are now being way more aware of the issues, and they're asking questions that they didn't used to ask and everything because of this uptick. So absolutely, people not going to their primary care, not doing the preventive maintenance, not doing all of the right things early on is affecting down the road.
If you could point to one or two things that a person could do today to assist in waging this battle, increasing awareness, what would they be?
Talk about it.
Yes.
Talk about it. Because once it's out there and people start talking about it, everything else will follow. Once we take the stigma away from it, the research, the money, everything will follow. You just need to start talking about it.
And last year when my brother passed away, I had been gone away for 2 weeks, and when I returned, I could not believe the number of people that I worked with that came up to me and told me that they were either in a substance abuse program, they had been admitted for some kind of mental illness. The things that they had gone through, they were very comfortable coming up to me, but they didn't do it in a group. They did it very privately. They came to me after a meeting to tell me. I was pretty shocked. I worked side by side with these people for 7 years. I never knew any of it. So talking about it is definitely, you need to talk to your children about it. You need to talk to your children about drugs and alcohol. What are they doing in school? What's going on at the dances? Are any of their kids talking about suicide? Facebook has changed our lives. That's another big influence right now. Facebook, Twitter, all those different things. Kids are very comfortable writing things on Facebook. We'll have children who see another person say, you know, I'm going to kill myself, and they'll call the parents of that person who may or may not get there in time. They really will do that. So I have children. They're 13, 11, and 9, and I must drive them crazy about drugs, alcohol, what their friends are doing, what's going on at the dances. You know, they know firsthand what happens, and I drive at home about what's going on. You need to talk to your children. You need to talk to each other.
And you need to make sure your children know that if they read about a friend that or somebody that is putting up these alarming, you know, messages and stuff, it is not being disloyal to their friend by letting somebody know about that, because there is this huge sense of loyalty that, you know, we're not snitches. We don't talk about, you know, what we read and stuff. And really what they're doing is they're doing the best thing that they can do for their friend is to let somebody know. They are crying out for help. It's just that we're not hearing them.
Maybe because they're spending too much time on things like Facebook.
But we can't. That's another issue
It
for
just
an
is what
issue
it
that
is.
matters for another time. But it
help?
is.
That is a major issue that matters.
Absolutely.
Because people have lost their ability to, as we chatted about it briefly before, we've lost our ability to talk about things.
Mm-hmm.
I see that as a major social issue in this country and possibly around the world. I don't know.
Yes, I can't imagine we're the only ones.
But we do tend to get self-consumed in things such as Facebook, and behavior of people when they're on Facebook is radically different from their behavior when they're face to face.
And that's one of the unique things about mental illness that is, for a major illness that is different from other major illnesses, is how it spans so many different areas and stuff. It's not limited to, you know, a physical condition. Mental illness goes from the Facebook messages to the schools to the, you know, all across everywhere. It's insidious little grasp on all sorts of different areas. And so many different components. There are so many components that go into mental illness.
I see a lot of similarities, not only, you know, of mental illness with physical fitness. You know, back in my day, and which wasn't all that many years ago. I mean, we used to do things in gym, climb the ropes, work out on the gymnastic equipment, play dodgeball. They can't do that anymore.
No, schools are limited with funding as well. They get less gym.
Yes.
Less things, but then after
And
school,
there's also the liability issue.
yeah,
Schools have limited what they will do in gym because of liability. They no longer play dodgeball in gym.
I didn't know that. I thought, yeah.
That's what I understand to be the case. I haven't been to a high school gym
me neither in a while.
when there were actually students in it in a long time. But I think some of the challenges that we face with mental illness, I think you don't have to go too far outside of that world to see other indications of problems of a similar nature. And you can talk about other illnesses and diseases. I know I can speak to multiple sclerosis, and many of the same hesitations about speaking about it exist, possibly for different reasons, but nevertheless, they exist, and we've got to be able to break down those barriers, and we've got to promote discussion. And I'll say that despite the fact that I'm often criticized for talking too much.
I know we mentioned NAMI a couple times during, you know, our segment and everything. So I did look onto their website about what they use the money that they raised from last year's
Please.
walk for. So if you don't mind, I'll just kind
I-
of read
I
a
would-
little
I would-
bit
I-
from, you
it
know,
goes
what
beyond not minding.
they raised a lot of money. I don't know what the number was. So last year, with the money they raised from last year, they produced over 80 suicide prevention and awareness training sessions that were attended by more than 2,000 people. They had over 125 family, peer, and veteran support groups attended by more than 34,000 people. And you had mentioned the veterans, so they do a lot for the veterans. They had 11 crisis intervention trainings to 279 law enforcement and correction officers and first responders. One of the things that Cherie is doing a lot of is really trying to change the way that our healthcare and our police departments and everything, how they handle people in crisis, because it is very different seeing somebody come into our emergency room that's in crisis versus other illnesses, and you might want to expand on that a little bit after I read these last few things. They did 15 family-to-family classes helping 187 families. They gave 128 respite providers, giving 17,000 hours of service to 710 families and 849 children, people going in and providing care. They took over 7,000 referral and provided information calls to help people navigate Maine's mental health system. So those are just a few of the things that they did with the money that they raised from last year's walk. Very important to get the word out, you know, what they're doing, and also just to remind people that we are walking on September 29th at the Southern Maine Community College. If you want to support our team, it's Team Hopper. They can call Cherie. Her number is
490-7451.
Or you can call me. My number is 490-7027, or visit the NAMI Maine Walks website, and you can sign up there. It's just, the more we can get the word out, the better off it's going to be. It's going to have a snowball effect. Once people start talking about it and they raise awareness, then people will be willing to get behind it and support it, and do really, that's how it's going to get, how we're going to improve on the issue. Did you want to talk a little bit, Cherie, about, you know, I know you've done a lot of work about when people come into our emergency department, and I mean, they're in bad ways when they come in.
We have been working very closely with the police force in our community. The chief of police has been very supportive of us with taking care of these patients. He actually that's one of his specialties, is working with patients who have mental illness. And we just felt that the way they were not necessarily treated, but the whole system is different if you have a mental illness than if you came in with a medical condition. You know, it's actually segregated almost. We say, you know, well, are they